When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Let's get to our next guest. He believes that opening up the economy is good for your health. And if you're scared to go back to work, he's developing an app to help deal with that. Joining me is Dr. Adam Hoffman, physician working at the Saint-Jérôme Hospital. Hi, doctor.
Hi, Elias. How are you? Thanks for having me on.
Yeah, it's great. It's great to talk to you. First off, let's talk about the hospital you're at. Let's talk about the Saint-Jérôme Hospital. How are things there?
Hectic. There are quite a few COVID patients in hospital, but I think it is probably significantly better than what we see elsewhere, including in Montreal and other cities.
And on International Nurses Day, you want to have a little shout out for your nurse colleagues?
Yes. Thank you very much for all of the nurses who help make our work possible and care for patients. Thank you very much.
Adam, you've got... you're saying something that a lot of people are thinking, that I think at times the government likes to sort of broach the subject. They don't, I'm sure they're sort of worried about being perceived as going too fast or not going fast enough. And, everyone wants to be a Monday morning quarterback here. But there's a concern, right, that as the economy stays shut down or portions of the economy stays shut, we could be, unwittingly letting other health issues arise. What do you want to say to that? What's your point here?
Certainly. Now, for perspective, I'm a physician who both works in the hospital and runs a preventive medicine clinic, as well as develops AI technologies for preventive medicine. And so my perspective is both acute and chronic. I look at decades and I look at minutes when it comes to medical care. And I'm going to start by saying that what we did till now was probably correct. When a patient comes into the emergency room and has a heart attack, you stabilize them. They've got to breathe, their heart has to beat, and so on. But what we're doing presently, now that we've managed to somewhat flatten the curve, we've been in Quebec, about 850 cases on a rolling 5-day average now for over 2 weeks. Now that we've managed to flatten the curve, we have to think long term. Mm-hmm. So when your heart attack patient comes into the hospital, you don't feed them cheeseburgers. You make sure that they learn the proper things about diet and exercise and how to prevent the next heart attack. And that's sort of the approach I'm advocating for Quebec society. And now I have somewhat of a unique perspective, I think, in medicine as both a business person and a doctor. And I'm thinking about the economic impact and its impact on my patients who come see me not at the hospital, but in the preventive medicine clinic. So if these patients are, by and large, of lower socioeconomic status, and some of them don't know how they're going to make it to the end of the month now that they've lost their jobs. Now, an important thing to understand is that poverty is a significant risk factor for disease. Poverty is a significant risk factor for mental health, for drug abuse, for alcoholism, for all sorts of things that over decades of time will kill many, many, many people. Mm-hmm. And while COVID is a terrible disease with a tragic cost, my thesis essentially is that if we fail to act to alleviate the economic impacts of the shelter in place and the lockdown orders and the sort of economic impacts of reacting acutely to COVID, we've traded an acute illness for a chronic illness that will probably kill more people than COVID will when COVID is faded from our memory.
So what you just said there, Dr. Hoffman, will probably kill more people than COVID when COVID is faded to memory. That's a big statement. What's our margin for maneuver here? How much longer can we wait in your estimation?
I think we have to act rapidly because, as you can imagine, every week that goes by, we sacrifice more jobs. Now, most of the data I'm working with presently when I'm constructing an argument comes from the United States. But economists from the United States imagine that, or rather project, there's a University of Chicago study that projects that 40% of jobs lost, particularly in tourism and travel and so on, and certain ones in agriculture, will become permanent after COVID, or rather, it's not permanent long term.
Yeah.
And so imagine they currently have they have projected unemployment rates of 30%. Canada will probably reach not as high, but something similar. And if 40% of those job losses remain permanent, imagine how many children are going to be affected by this. And we know children who live in households that grow up in poverty have increased rates of abuse, neglect, and things that lead to eventual drug abuse. Even cardiovascular disease and cancer has been associated with what we call adverse childhood events that is itself highly associated with poverty. And so you can imagine the scale of what we're talking about is in the United States, tens of millions, but in Canada, it would be millions of children who would be impacted by these permanent or rather long-term job losses. And so I would argue that the most pressing medical need presently, in addition, concurrently and parallel with dealing with COVID, is to deal with the economic crisis.
Can I ask you, doctor, if you're getting pushback from your colleagues, your fellow doctors? They're saying, "What are you talking about here?" Like, are you getting that, or is it the opposite? You're saying, "Hey, yeah, we got to start thinking about this a little bit more."
Well, I think the initial reflex of every doctor, and it is correct, is to deal with the acute. But what we have to avoid is the cognitive tunneling of saying, "Oh, okay, acute, acute, acute," and ignore the chronic, especially when the chronic creeps up on us quickly and is of our doing. Mm-hmm. So I don't think I think there may be pushback, but I think what will happen is I might be a little ahead of the curve here, and people will come around and realize this. But the numbers are fairly convincing. We're talking, let's look again at U.S. numbers. The worst case estimate that the CDC put for mortality in the States was 1.7 million people could die. 1.7 million people could die. Now, if you put that next to the economic numbers and the long-term risk of cancer, obesity, cardiovascular disease, suicide, and so on that comes with poverty, we're talking about 10 times more people dying. Because of the self-inflicted economic disaster.
But you're not advocating for let's just open up the gates here, right? You're advocating
God, no.
So what's the right way to do it? What's the right way to reopen so that, because I think a lot of people are listening and they feel you're advocating to open up the gates, but it's much more nuanced. So what's the right way?
Yes. Thank you for pointing that out. Listen, like I said, I develop artificial intelligence platforms, and I've developed an application that is based on what my patients want when they call me in my telemedicine practice for the preventive medicine clinic, which is, "Hey, doctor, can I go back to work? Is it safe?" And I don't tell everybody, "Hey, you can just go back to work." No, I say, "Hey, this is your particular risk. This is your personalized risk. It's based on the following clinical risk factors, and here are my recommendations." And my company, Prevention Technologies, and my app, which is called COVID Risk App, which will be up at covidriskapp.com very shortly, will be open and free to the Quebec public and the general public, where they can go in and ask themselves that question: "Hey, am I at risk of going back to work? How do I have a discussion with my employer?" And so on and so forth. And when and if we go back to work, we can't go willy-nilly. We can't send the patients who have, God forbid, leukemia or diabetes, just to rub shoulders with everybody. You have to take appropriate precautions. Yeah. Moreover, the back to work is not going to look like it was prior to COVID.
Dr. Hoffman, we got to leave it there. But listen, I enjoy talking about things that may be a little bit outside the mainstream right now, and it'll be interesting to see how the government handles this and just how quickly they reopen. Thanks so much for joining us.
Thank you for having me.
That's Dr. Adam Hoffman, physician working at the Saint-Jérôme